So, hi guys, you are very welcome back to my channel, and I'm delighted today a lot of you have been asking about hormone health, thyroid health, and I'm delighted that I'm joined with the amazing Helen today, who is an expert within thyroid, autoimmune, and I know I've got loads of questions for her. So Helen, you're so welcome to my channel. And before we get into everything, I'd love for you to share with the audience how you became a nutritional therapist and what led you on the path of health.
Okay, so what decided me to study nutritional therapy in the first place was my own health. I was in a pretty bad way, to be honest. I was struggling hugely with fatigue and pain, brain fog. There was a lot of other symptoms as well, but they were the ones that were really the worst that I struggled with. I'd been diagnosed with multiple autoimmune conditions. I'd been diagnosed with celiac disease, with Hashimoto's thyroiditis, pernicious anemia, which is a autoimmune vitamin B12 deficiency. And also the last one that I'd been diagnosed with was fibromyalgia due to the fatigue and pain that I was struggling with.
Amazing. Okay.
So that is what pushed me into studying it. I'd been gifted a session with a nutritional therapist for my 40th, and it made a massive difference. I had a couple of sessions with her, and she then retired. And I thought, if I've got this far with recovering, how much further can I get? And that's when I decided to invest and study with a nutritional therapy.
Brilliant. And I think a lot of people that get into nutritional therapy, like myself, we've gone through things which brings, and we want to help other people. But for those that are listening today, and like I know in my clinic, I see a lot of women coming in and they either have underactive thyroid or there's something not right and they haven't put their finger on it. What are the signs, the initial signs that somebody may have something wrong with their thyroid?
Okay, one of the biggest symptoms that most people associate with underactive thyroid is weight gain. However, that wasn't a massive symptom for me. I was overweight compared to what I am now, but it wasn't a huge amount. So that is something to look out for, is that unexplained weight gain. If you've changed nothing and all of a sudden you're gaining weight, there might be a reason behind that. You might want to look into it. But also along with that is the fatigue. Even if you get a good night's sleep, that feeling like you're just dragging yourself through the day and nothing makes any difference. That level of fatigue, the brain fog, so the problems with the memory. I had problems with my speech. I was very forgetful. I couldn't get the right words. I'd use the wrong words quite a lot of the time. So it really affected me mentally, which really knocked my confidence quite a lot. Okay. Feeling cold is another one, but like you feel like you can never get warm, particularly your hands and feet are like ice blocks. Low mood, depression is another sign, symptom of an underactive thyroid. There's quite a few: hair loss, low libido, increased cholesterol. If you notice that on your blood markers, okay, it can often be a sign of an underactive thyroid. Joint and muscle pain, weakness, itchy, dry skin. My skin drove me insane. It was so itchy and so dry. Nothing made any difference. Nothing I put on it absolutely made no difference. And then digestive issues are quite common: constipation, because your metabolism has slowed down, heavy irregular periods. I had quite a lot of PMS. I would lost count probably the year before my diagnosis with Hashimoto's, the amount of times I brought pregnancy tests because I thought I was pregnant, because my period was so late. It was so all over the place. It really did knock my cycle for 6. So because
there's a lot of symptoms that, you know, people can just tick a box and go, okay, and they just put it down to either, you know, maybe I'm just getting old, or maybe it's something that I've eaten. I know with myself 3 years ago, like that, I was ticking a lot of those boxes, but then I started to, as most people do, is self-diagnose, and everything I was ticking was perimenopause. And I was like, oh, now, obviously, I'm at the age that I probably am at perimenopause, but do you find that with people as well, that they can self-diagnose and it's very similar to the perimenopause symptoms?
Yeah, absolutely. I'm at that stage now, of that kind of age of perimenopause is starting to kick in. And a lot of women tend to get diagnosed with the underactive thyroid at perimenopause.
Okay.
And like you say, they've probably ignored some of those symptoms for quite a while, thinking, oh, it's just how it is.
Yeah.
If you are having those symptoms, go get it checked, because it may not be just the perimenopause. It may be an underactive thyroid as well.
So definitely, if your advice then, if somebody is listening today and they go, oh, yeah, I'm ticking a lot of those boxes, what's their first, because sometimes it's a bit scary and a bit overwhelming. So what should they do initially?
So my advice would be, make a list of all your symptoms, go into your doctor. It's far more concise if you've got that list there that you can just hand over. It makes their life easier. It makes the kind of consultation quick, and obviously time restriction is an issue with like medical appointments.
Yeah.
So I always go in with everything listed that I'm struggling with, so I don't forget anything, because obviously the memory was quite a problem, so I used to forget a lot of things. So make sure you've got that list and go in and explain what's going on. Ask for your thyroid to be tested, and ask for a full thyroid panel, not just TSH, because you can have normal thyroid hormone levels, but if you've got Hashimoto's, those antibodies can be elevated quite a while before it makes an impact actually on your thyroid hormone production.
Because I think for me, before I got into nutritional therapy, like 10 years ago, I was diagnosed with an underactive thyroid, and I rectified it without medication. And disclaimer to my audience, I never say not to take medication, but it's something that I went off and tried to do with not taking medication. But, you know, you've mentioned Hashimoto's. I didn't know what Hashimoto's was 10 years ago. I never got tested. I literally just got the basic test. So would you recommend people to kind of look up and educate themselves a little bit more before they go, and maybe work with someone like yourself to get that?
Definitely.
Yeah.
Know what you want when you go into your doctor. So having read up and research is going to be helpful. If you're working with somebody like myself who specializes in that area, who's a nutritional therapist, then they're going to be able to guide you as to what to ask for. And quite often I find doctors are far more receptive to testing if you're already working with a nutritional therapist. I found the same personally. I was diagnosed with celiac disease probably 8 years before I was diagnosed with the Hashimoto's. My thyroid was tested at that point, and the levels were abnormal. They retested it in 6 weeks and the levels were fine. And that's quite common in early stages of Hashimoto's, for your TSH to swing in and out of range. So I wasn't retested for another 8 years, and throughout that whole period I had symptoms increasing until I was in quite a mess with it. And they then tested the thyroid and the antibodies at that point. But yeah, it took a lot of me going in and saying there's something not right. And it was several years.
It is that journey that even when you are diagnosed, there's a whole roller coaster of ups and downs, and for you to find your feet. But for those listening, and people are probably going, okay, underactive thyroid, Hashimoto's, can you explain a little bit to my audience about autoimmune Hashimoto's and the difference between the thyroid and that, just in case?
Okay, so Hashimoto's is an autoimmune disease in which your immune system starts to attack its own tissue. In this case, it attacks the thyroid, which eventually causes enough damage that it affects thyroid hormone production, and levels will start to drop of those thyroid hormones. And your TSH will start to shoot up in response, because your TSH is basically telling your thyroid how much hormone to produce. So if those levels are dropping, the TSH is going up because it's kind of saying, come on, produce more, produce more. And it can only keep that up so long before those levels really start to drop out of range. That's when you have the underactive thyroid. That's when you have the hypothyroidism. That is generally when you are offered treatment. So this could be going on for years prior to that damage being sufficient for that treatment to be given. And the treatment itself addresses the deficit in the thyroid hormone production. It does not address the autoimmune side of things at all.
And I think that's the key. When people are given medication, it's not a one size fits all. It's going to heal them. They need to learn and work with somebody that can help them through the autoimmune part. So what can they take the thyroid medication, that's going to work on one level. What about the autoimmunity? How can they support themselves there?
So there's a lot that you can do on this side of things with diet and lifestyle. Some of the reason that kind of the Hashimoto's has started in the first place may be genetic. That accounts for quite a small proportion of it. It's what's turned that gene on basically for the development of that autoimmune condition. So we're looking at what's driving that, what's keeping it going, what's keeping that autoimmune attack going, and how can we calm it down. So when I'm working with a client, I will look at lowering inflammation, as this is a big part of pushing that autoimmune process. I'll also look at gut health. Leaky gut has been shown to precede autoimmune development. So addressing gut health, getting that leaky gut back under control can help. It can help reduce the inflammation. It can help kind of stop the production of those thyroid antibodies. So a lot of what you're eating can be inflammatory.
Wow.
And a lot of your lifestyle can also be inflammatory. That on the go, never stopping, kind of always on your stress response kind of thing. Not getting the right amount of sleep, basically not getting the right kind of exercise. It can all make a big difference on how that autoimmune kind of response basically continues or not. So trying to look at diet and lifestyle, trying to get those inflammatory foods out of there, balancing your blood sugar so that you can, again, that will increase inflammation if it's out of control. So a lot of it is diet side, but we will also look at things like toxins, your environment, what you're being exposed to. There's quite a big side of things, and system balance as well. So how your liver is functioning, kind of what are your adrenals doing, are they kind of overtaxed and need some support? So it's about restoring that balance basically.
Right. Because I think sometimes we go straight into food and think, okay, we need to get rid of X, Y, and Z. But I know for me, what really spiraled my condition was stress. I noticed since I had my daughter, it was almost like this adrenaline kicked in, like the super mom. We're labeled super moms now, I believe. The modern woman is just go, go, go. And I just thought this was part of normal life. And then, opened up my own business, went back and studied college. And then it's only now that I'm kind of 12 months out the other side, I'm going, wow, if I had kept going and maybe not get tested, you can really get sick from not looking after your own health. And you mentioned the foods, because I know a lot of my audience will be really interested in where could they start with foods, because I know for me, two of my triggers would be gluten and dairy for sure. Is there any? Would you agree?
Yeah, definitely. They tend to drive that autoimmune process. They increase the leaky gut, which increases immune response, and the chances of that autoimmune kind of side basically accelerating and producing more antibodies that attack the thyroid. So you want to try and get those out of there if you possibly can. Most of my clients are gluten and dairy free, and find that their symptoms as a result have improved or completely disappeared. So that is possible. You don't have to, yes, you have to manage it. Yes, if you start eating the gluten and the dairy again, those symptoms are going to come back quite quickly. But you can do that. Another one is soy, which can be an issue because it can block the receptors up into the thyroid. And it stops that iodine getting into the thyroid. The iodine is needed to make the thyroid hormones. Your T4 and your T3, the number basically tells you how many iodines are attached to kind of that thyroid hormone. So T4 has 4, T3 has 3. You need the iodine, and if that soy is blocking the receptors and not allowing the iodine to get in sufficient quantities, you're not going to be able to make those thyroid hormones as you should. So that can be an issue as well for a lot of people.
And with regards to soy, is that everything, even including the soybean, soy and milk, everything that just says soy on it basically?
I tend to avoid it myself. I feel better without it. Some clients will find that a little bit here and there is absolutely fine, but they notice if they start having it consistently, then it does make an impact. So
because it can be sometimes if somebody has an autoimmune and the inflammation receptors are there for dairy and gluten, that can be a big change for somebody just to make. So how long would you say if you're working with somebody, it's not like a 4-week process and out they go, it's a journey, isn't it?
Yeah, usually my main program that I offer is a minimum 6 months. When I'm working with a client that has Hashimoto's, because I know that time is needed to unpick what's going on underneath so that we can stop that process, so that we can stop that attack, we can get rid of the symptoms.
So with when somebody is diagnosed and they are put on medication, I know I always ask the question, am I on this for the rest of my life? What's their journey after diagnosis like? I know everybody's different as well.
Yeah, it depends. I think some people that catch the Hashimoto's quite early can get off that medication. And some people, if they catch it before going on the medication, may not need it in future. It took quite a few years for my diagnosis, and I think it had been going on a long time prior to that first abnormal result that I had as well.
Yeah.
So by the time that I was kind of given medication, I think the damage was too severe for me to be able to come off that medication. However, my medication levels are stable now. I used to find that it fluctuated quite a lot.
Yeah.
And obviously that would have been kind of extra stress that I wasn't aware of. It would have been eating things that I didn't realize were driving that autoimmune response. So yes, it did fluctuate, and I found it quite difficult to manage where my medication level needed to be. And I was constantly having what kind of is usually referred to as autoimmune flares.
Okay.
So yeah, it depends, like you say, on the individual. Some people can come off that medication, some people can kind of avoid it, and some people unfortunately are at that stage with the damage is severe enough that it's going to be for life.
Yeah.
But
And
that doesn't, sorry.
No. What are your views then? Because again, there's a lot of people out there. There's a lot of different diets, and do this, do that, and people become so overwhelmed. But what's your thoughts on, a high raw food, plant-based diet, getting as much fruits and vegetables in? Is that a support as well?
Yeah, so when I work with my clients, my priority is removing the inflammatory foods, which tend to be things like sugar, refined white carbohydrates, processed foods, and then replacing them with whole foods. So definitely plenty of vegetables, plenty of fruits, plenty of kind of beans, pulses, nuts, seeds, and then I generally do advise some kind of animal products in there. Because you're obviously already taking the dairy out, you're taking the gluten out. If you're taking the kind of the meat, animal products out as well, it's quite a lot that you're taking out of your diet. So yeah, that's usually what I recommend. But like you say, predominantly it would be plant-based with some animal products in there to support.
Brilliant. And I know, like, my kind of area with my clients is weight loss, and I do find I'm working with people maybe for 4 weeks and the scales isn't moving, the fat percentage isn't moving. That's when I'll send somebody to the doctor for a full blood panel, making sure they're getting their thyroid tested. But is there any, I know that you've recently done a successful blood sugar weight loss challenge with your clients. Tell us a little bit more about that and how balancing the blood sugars can actually help people with underactive thyroid, autoimmune.
So yeah, last week in my Facebook group, I ran the balancing blood sugar for weight loss challenge. It's the first time I've done that particular challenge, and it went down really well. There was a lot of people that were quite shocked how simple it was, but the fact that they'd never been told any of the information of which foods are driving that inflammation, driving that blood sugar kind of dysregulation, and which foods help to balance that out. So like I said, a lot of those inflammatory foods I mentioned before tend to drive that blood sugar imbalance. So if you're kind of on the edge of looking at pre-diabetes or diabetes type 2, then you need to get that blood sugar back under balance. If you don't address the blood sugar, then you are going to struggle to lose that weight. It is really difficult. So it's not so much about calories, it's not so much about restricting your portion sizes. It's more about what you do eat and what you don't eat, and in what balance you eat that food. I find that is the most successful way for my clients when they're wanting to lose weight.
Because I think sometimes people just get so frustrated because it's, as I always say to people, what we did in our 20s and our 30s, if we're at that 40s and we're perimenopausal and we've got the underactive thyroid, have to look at a completely different plan in place.
And when you look as well at, when you mentioned before with stress, that can cause imbalances with your blood sugar as well and drive that inflammation. So when you're looking to lose weight, it's really important that you don't just look at diet, but you also look at, are you getting enough sleep? Because that can cause extra kind of calories to be consumed, those cravings to be out of control. Are you kind of really stressed on the go all the time? Do you need to kind of manage that a little bit better so that it regulates your blood sugar better so that you can lose the weight?
100%. And I think the advice for people is there is a way, it's just a different way of looking at things and working with somebody. So what would be your advice then if somebody is, they've reached their 40s, they've started to get perimenopause symptoms as well, they've been recently diagnosed then with either thyroid or underactive? That's now a different way that they have to look at things. What would be the main changes that they need to do?
So a lot of what underpins the perimenopause symptoms are the same things that underpins the autoimmune Hashimoto symptoms. So that inflammation is going to be a big factor. That blood sugar balance as well can make a big impact of how severe your perimenopause symptoms are.
Yeah.
And your adrenal health as well. So when your ovaries kind of start to reduce the production of your progesterone and your estrogen, your ovaries pick up some of that slack. And your adrenals pick up some of that slack. Not to the same extent, but if your adrenals are already kind of working pretty hard because of that stress-life balance, and kind of maybe the imbalance with the thyroid, because obviously it's all part of the same endocrine system, it all knocks onto each other. So you need to have that imbalance in order to basically get that perimenopause side of things under control. So supporting your adrenals is going to be a massive part of that. And again, that stress management, kind of basically that inflammatory foods, those kind of things, correct sleep, that detoxification process for your liver, it's all going to help reduce those symptoms of that perimenopause. So again, it's the same kind of things I mentioned before, that same diet, that same lifestyle.
Because I think people, they just take stress as part of normal life now, and but stress is the silent killer, and it has all these kind of other things that triggers in the body. Is there any deficiencies that people may have as a result then, that they obviously, if they're working with a professional, they'll be be recommended different supplements, but is there anything in particular that you might see in clients that they're deficient in?
Yeah, particularly with the thyroid, I quite often see the stomach acid levels are low, which that is quite associated. Research shows that has an increased association. So basically you need to look at improving that. And again,
so we were just saying about deficiencies then, so some of the main things, and you were saying about the low acid in the tummy.
So that can affect your absorption and breakdown of your nutrients. Some of the most common ones that I see deficiency with are iron. That is harder to break down if your stomach acid isn't as it should be. Zinc is another one. You need that stomach acid in order to absorb your zinc. You need the zinc to produce your stomach acid. So it's kind of a bit of a vicious circle. And zinc is also needed for thyroid hormone conversion. So from your T4 to your active T3. So that's really important. And also selenium is another one that tends to be low with clients. And again, that is needed for thyroid hormone production and for that conversion process.
Amazing. That's one of the ones that I found when I started to just supplement. I found the product Pharmanord, the selenium and zinc, and within 2 weeks, the difference that I seen. And then obviously in the summer, I just decided, sure, I'll just stop taking everything. I don't know what it is. When the sun comes out, you feel, I don't need anything. But I kind of things started to deteriorate again. I was like, what did I do differently? And it's like, okay, get back on the zinc. I think zinc and selenium are really ones for life. Well, for me anyway.
I noticed with my results that that conversion rate, the T4 to T3 ratio, improved massively when I added the selenium and the zinc. So brilliant. Some people struggle with that conversion process, and some people find that they need a T4, T3 medication, not just that levothyroxine on its own. I personally have done that, but I also found that the selenium and zinc increased that conversion even further and helped much more. What else? Iodine for me was a big one. That is quite controversial. Some people with Hashimoto say you should avoid it, and I certainly agree. If you aren't deficient, you shouldn't take it. And if you are deficient, you need to test, and you also need to make sure that if you are taking it, that you are following like a proper iodine protocol, that you are taking the co-nutrients that go with it, and selenium is one of those that's really important. So you need to make sure you're taking things in conjunction together. Vitamin D is another one that can be quite often low. Mine was very low, and I struggled to increase that until I got my stomach acid levels as they should be. And that can help regulate your immune system. So they've shown that it can help bring your thyroid antibodies down. Basically, if you get that immune system back in balance, it can reduce your thyroid antibodies, as can selenium as well.
That's fantastic. And I think like that, it's such a minefield that people can't go it alone. I know as a sufferer, you cannot go alone. You have to get support. You have to get help. And if anybody's listening, Helen, and they want to reach out and they want to work with someone like yourself, where can they find you?
You can find me on my website, which is helenmalaburn.com. You can also find me on Instagram, which is again Instagram at Helen Malaburn. I have a Facebook group which I share my kind of experience, my expertise inside of. Quite often I do free challenges like I did last week, and that is Hashimoto's Nutrition and Health. Yeah, you can find me on YouTube, Pinterest as well.
Brilliant. And if somebody then starts to work with you, you obviously will put them through, they needed like gut health tests, any of that's all taken care of within working with you.
Yeah, so my 6-month program is inclusive of kind of all that. Obviously, the price of the testing is additional, but the kind of recommendation of tests, the ordering of tests, the analysis of those tests, interpretation, that's all included in the program.
Amazing. Okay, well, Helen, thank you so much for joining us today. Guys, if you have any questions, you can reach out directly to Helen, and don't forget to like, and if you're not already subscribed, subscribe to the channel. Thanks, guys.